In this video, we're going to create a chart protocol related to CMS 166, Use of Imaging Studies for Low Back Pain. This is to contribute to Meaningful Use Stage 2 Core Objective 6 Clinical Decision Support Rule. We actually have a summary video that explains that objective and why we need chart protocols to help meet it. If you haven't yet watched that summary video, it'd be a good time to go ahead and stop and take a look at that. It helps to explain what we're doing and why. So for this video, again, we're going to be creating one related to imaging studies for low back pain. This is a good next one to show because it's a little bit more intricate than the prior two. It will check on diagnosis codes. So we're going to click More Info to get some detail here. And in this case, we're looking for a percentage of patients 18 to 50 years with a diagnosis of low back pain. And the measure is looking for those that did not have an imaging study within 28 days of diagnosis. For our intervention, what we're going to do is remind ourselves to either send them out or discuss an imaging study with the patient if they're in the age range and they have that diagnosis. So to do that, I'm going to go ahead and minimize my browser here, and I'm going to go to Chart Protocols. For that, we go to P, Setup, Chart Setup, and then Chart Protocols. And we're going to add a new one. Go ahead and call it CMS 166. It's going to be low back pain. And again, the code and description are for your own use. Notification message is the summary that will show. And the detailed instructions are the instructions to give yourself whenever this is a hit for the patient. The last important piece is we want to set the execution type to automatic rather than manual. That will notify us automatically in charts if this is a hit. So now we're going to go ahead and add some diagnoses. Since part of the requirements, we'll pull that up again, were age-related and part of them were a diagnosis of low back pain, it lets us dig in a little bit deeper and see what else chart protocols can do. So we're going to come to Practice Studio, add a criteria, and this time we're going to come down and select a diagnosis. Okay, now we can add multiple diagnoses to this list one at a time. I can say add, and I can add, say, 724.2 for lumbago and continue on. Or if I have several that I know I want to add, I can go ahead and just, instead of equal to, choose in, which is what we're going to do. And we're going to add multiple. So in this case, it's just a little bit faster way to do the same thing. 724.2, comma, 724.3, comma, 724.5. And these are the diagnoses that you typically are going to use to diagnose low back pain. There's the 3 examples. And we can usually limit it by time. So for this to be a hit, it has to be within 1 year. The diagnosis has to be within 1 year of the date you're running the protocol. So we'll go ahead and confirm that and say save. And we will also add a screening age. I believe that was between 50 and, 18 to 50. So we'll say between 18 and 50 years old. It will not recur. And we'll save. Okay, so now let's see this work. We're going to go in on an example patient. I'm just going to medical records. Let's P provider medical records. We'll pick our younger patient that hits within that age range. We'll create an encounter. Okay, we can see we have no health protocols at this point because we don't have a diagnosis on the patient. But if while I'm in the act of creating my encounter, I go ahead and give him that diagnosis. So I'm going to say he has sciatica. And I'm going to go ahead and bill him out as a normal office visit. So it's a new patient. And I'll associate that diagnosis with the charge code. So now I've posted my diagnosis. It's associated with my visit. When I get out, it's going to notify me that the protocols have changed. There's now a new protocol for low back pain. And I can look at the details of that protocol, see that it's asking me, due to the CMS measures I'm pursuing, to have imaging studies for some percentage of these patients. I can take the appropriate action there, either order it myself or recommend the patient go do that, resolve or dismiss it to remove it from my list, and we'll be done.